Yeah. Hi, everyone. Whoa. Okay. Hi, everyone. Okay, so we'll begin our event. And if at any time, again, there are snacks at the side, feel free to grab those. Okay. All right. Good afternoon, everyone. My name is Aisha Khan, and I'm a research assistant at the Canada Excellence Research Chair in Health Equity and Community Wellbeing at Toronto Metropolitan University. Thank you for joining us today for our panel on health justice in reporting with Odette, Auger, Meagan, Gilmore, and Colin Hastings, all seated here. Today's event is hybrid, with some of you gathered here on the TMU campus and others joining us online from across Canada and technical stuff. Okay. Others joining us online from across Canada and beyond. Zoom captioning is provided. For those online, please select the CC button on your Zoom menu bar in order to see the captions. And due to the themes we are discussing, we understand that folks may need some time and space to care for themselves throughout the day. If you are in need of emotional or psychological support, please contact the number for Vita Active that you can find down here. This is a free, confidential, and anonymous helpline. They offer support via WhatsApp and Signal at the number on the screen. This is also listed on each of the slides of the screen. Vita Active focuses on a feminist and inclusive approach, offering active listening, solidarity, and psychological first aid. All right, so before we start the event, I would like to offer a land acknowledgement and acknowledgement of country. I acknowledge the traditional owners and custodians of country and land throughout Australia and Canada. We acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishnabek, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto, or Toronto, is covered by Treaty 13 with the Mississaugas of the Credit. I would like to pay respect to elders past and present, acknowledging First Nations peoples' shared experience and impact of colonization on their health and well-being, their families, kinship networks, and communities. We recognize the sovereignty of all Indigenous nations as the original inhabitants of these lands and waters, and we give thanks for the opportunity to work, live, and play on this land. As a daughter of immigrants, I recognize that I'm a settler on these lands through my parents' journey across the globe, and I'm grateful to be here. I urge us all to continue to learn about the Indigenous peoples and their rich history and traditions. Now, a little bit about the CERC in Health Equity and Community Wellbeing, led by Dr. Karen Soldatich. There she is. We are a transformative research initiative that employs an engaged community partnership approach to expand our understanding and practice and delivery of health outcomes for all members of our communities. Through collaboration with a network of healthcare institutions, service providers, and civil society organizations, the program aims for a paradigm shift, one that challenges a siloed, expert-driven approach to health and well-being, and moves instead towards a community-engaged, preventative model of well-being. Uniquely applying a critical disability lens, this research program aims to not only reduce health disparities that are inextricable from their social context, but to embed community knowledge into healthcare institutions, systems, and models of delivery. All right, so I would also like to talk a little bit about what gave rise to today's event. Danielle Landry, a research associate here at the CERC, and I have been working on a project for the past year entitled At What Cost? Framing mental illness in digital news media coverage of medical assistance in dying. I'm happy to announce that today's event marks the launch of our report, so we do hope that you check that out. We have some copies here available. And this report consists of our project, our findings, and recommendations. Our study aimed to evaluate the socio-political risks of current news reporting practices. Our research team, led by Danielle, including Madiha Kafil, Matt Jackman, Max Ferguson, and myself, conducted a critical discourse analysis of English language Canadian news media articles from the past 5 years using Factiva to understand how MAiD and people with mental illness and diagnosed with mental illness are rhetorically represented within these texts. We outlined the evolution of MAiD legislation in Canada and the ongoing debates of whether MAiD is considered a suicide or not. We found that this topic is primarily written up as a political news story rather than a health issue. And the voices of everyday people, experiences of people with lived experience of mental illness are limited. And this absence raises concerns about the implications of MAiD's expansion for these impacted communities. So to enhance the quality of and inclusivity of MAiD and mental illness reporting, we have 4 recommendations that are in our report. The first is that MAiD be reported on as a health issue rather than political news to better engage the public and community in health matters. Second, we recommend that the Canadian media guidelines for MAiD be developed and that impacted communities be involved in the development of those guidelines. Third, we place emphasis on the need to minimize harm and avoid equating mental illness with suffering in order to prevent harmful stereotypes. Thank you. Fourth, it's recommended that news outlets and reporters covering MAiD consider the photographs that they use more carefully to avoid tropes. All right, next. So in addition to our report, which you can find at this link or that QR code, we'd also like to invite you to listen to our Disability Dialogues podcast episode on this topic. You can stream it on Spotify with this QR code. And I also want to shed some light on the textile design that we have here. This is, and the textile design is featured on the cover of the report. And it was created by our very own Danielle Landry. The red dots represent 4.7% of the Canadian population, which is the current rate of MAiD deaths in Canada. The color scheme of red, white, and black represents newsprint. And we have the original textile in the frame on the side here if you'd like to take a look later on. Although MAiD and mental illness was our starting point when we were looking at health reporting, we really wanted today's discussion to center around health journalism in general and how people with lived experience of health issues can contribute to health reporting. All right, so this leads us to our panel. I am thrilled to introduce our guests here. So we have Odette Auger, who is a member of the Sagamok Anishnabek First Nation and is an award-winning journalist, including 8 Indigenous Journalists Association awards in the past 2 years, and a finalist for the Canadian Association of Journalists, Emerging Indigenous Journalist for 2024. Deep listening, respectful interviewing practices, and centering Indigenous perspectives led her to finding her own narrative voice. Her first piece of creative nonfiction, Waiting, was published by the Malahat Review in fall 2023. We have Meagan Gilmore, who is an Ottawa-based journalist who has reported on the intersection of medical assistance in dying and disability since February 2020, when legislation to expand the eligibility criteria for MAiD was first introduced. Her reporting on the topic has been featured in various outlets, including TVO, Accessible Media Inc., and The Walrus. Her June 2023 Walrus article about MAiD and disability, titled Too Easy to Die, was the 2023 winner of the Gary Corcoran Student Prize for Excellence in Reporting on Disability from the National Center on Disability and Journalism at the Walter Cronkite School of Journalism and Mass Communication at Arizona State University. In October 2023, Meagan joined the team at Canadian Affairs, a new independent national news site focused on covering the toughest issues impacting Canadians today. She continues to report on MAiD regularly. And lastly, we have Colin Hastings, who is an assistant professor in sociology and legal studies at the University of Waterloo. He holds a PhD in sociology from York University. His research is rooted in feminist approaches to activist scholarship and investigates public health surveillance, the growing privatization of public health systems, and digital media. He's the co-guest editor of an upcoming special issue of Social Science and Medicine that critically examines criminalization and abolition as social determinants of health. A longtime advocate against HIV criminalization in Canada, he is a member of the Canadian Coalition to Reform HIV Criminalization, a national coalition of people living with HIV, community organizations, lawyers, and researchers that is working to progressively reform, repeal, and limit the scope and harms of and or abolish discriminatory criminal and public health laws and practices that punitively regulate people living with HIV in Canada. Colin's new book, Digital News and HIV Criminalization, is available through the University of Toronto Press, and you can use the code Hastings25 until July 20th to get a 25% discount. All right, so today's panel questions were created by Danielle Landry, as well as Lucia Costa, who is the Deputy Executive Director of the Empowerment Council, a patient advocacy organization working to empower the collective voice of service users of mental health and addiction systems. We're thankful to have Lucy's insight in these questions. And now I will sit down and we can get started with the questions. All right, so the first question I have for you is, can you start by telling us a little bit about the work that you do and what are you advocating for in your role specific to health issues? Whoever wants to volunteer can go first.
I think we should let one of the journalists go first.
Okay, I can go. Okay, so every single one of my stories centers Indigenous voices, the lived experiences, and that's just like heart and center of every story. And so what I would advocate for is very similarly always coming from starting, middle, ending. The story is all about that. But also naming the social determinants of health. It's never a single issue. It's always full circle.
So I'm going to start that answer by saying that when I was invited, when Danielle sent me this lovely email a few months ago asking me to participate in this panel, I almost wrote back, "Hi, why am I getting this?" Because I'm a generalist. I'm a journalist. I report on many topics, not just MAiD. Okay, I just want everyone to know not every story involves people dying, just a large number of them. So in terms of my reporting on this topic, what I would want, because as a journalist, I am very wary of the word advocate in this role. I would want you to understand the facts of what is happening in Canada on this issue. And to be able to take the factual information and then based on that, critically analyze what you are being told from your government, from other political parties, and from lobby organizations that work on this issue. But really, that's the big overarching thing. And then in particular, beyond that, for you to see how do these laws, like how does it impact people on a practical level beyond just the healthcare system, although the healthcare system is obviously an important part of MAiD, but what are the reasons that people have for their support and their opposition for medical assistance in dying, no matter how that looks, and then what are the ramifications for these laws when it comes to people's everyday lives?
Yeah, first of all, congratulations on the report. It's such important work and so exciting to be part of the launch today. And thank you so much for all the work that went into organizing this. I share Meagan's sort of hesitancy about maybe feeling a little bit out of place in this panel. I'm not a journalist. I didn't go to journalism school. I've never published a piece of journalism. I sort of arrive at this discussion as somebody who was part of the movement to end HIV criminalization in Canada. And what we were recognizing in our advocacy work was that, like, yes, this horrible piece of legislation is made possible by what happens in courts and the work of lawyers and judges and medical experts and public health practitioners, but it's also made possible by a particular discourse that we saw again and again in news media. And so we just took really seriously this really concerning trend where the sort of only way that this issue came into the Canadian public consciousness was when somebody was charged in an HIV non-disclosure case. And it was the sort of same terrible tropes that were brought up again, the most stigmatizing, racist, anti-migrant sort of descriptors of what this issue was kind of all that people had to make sense of what is actually a very complex and nuanced public health issue. And so the work that I've done has been trying to figure out how that type of discourse happens so that we can remake it and do something different. And so, yeah, my work has been about going into newsrooms, being very grateful to reporters who have helped me sort of understand what news production is, what it looks like, how they go about that work, and trying to work with community organizations to support more nuanced, socially just types of reporting.
Great, thank you. I will say that the intersection for this project, but also I can understand why at first you felt like, wait, well, what's happening here? But this is one of the reasons why, like, the work that we're doing at the CERC in health equity and community well-being is really making sure that we're not just staying in those siloed areas and making sure that everyone from various different experiences and fields is able to take part in that knowledge creation. Okay, so the next question I have is, it says in a minute or less, but you can take a little bit more time. What is your central concern with how health issues are being reported on currently? So I know you touched on that a little bit, but if you could elaborate a little more. Yep.
Okay. I think most of the time, those social determinants that I just mentioned are ignored, or they're mentioned just in passing, and poverty, income, etc. But I think without that, there is no story. Like there's just if it's just a single facet, and I think that comes into play as part of the editorial process, and I try to use a lot of compassion here that it's probably unconscious, but even so, I think that there is still a colonial lens that's applied, and whether it's for the sake of we're just streamlining the focus, or that's not really the immediate news part of it. It's better if I give an example. So I was talking about cultural safety trainers, and so I was interviewing a number of cultural safety trainers specific to health workers. So they would go in and train doctors, nurses, et cetera. And they gave me the stats in natural conversation, how few Indigenous high school teachers there are, how few in the justice system, how few nurses. And it was, it was a paragraph. And, my first editor was like, that's irrelevant. We can tidy that up. Just take that out totally. I was like, she didn't give me this to pad the word count. Like, it meant something to her. She was saying that this is a foundational to our understanding of why we are in the place that we're at. And that was, this is coming from the people who are contracted by health authorities to come in and train their staff. And so she's saying the problem is larger, and it's because we lack representation across the board. And so I think, very fortunately for me and the story, I would say, a BIPOC editor entered the process at that point. She said, of course, she agreed completely. She said, of course, that is the foundation of the story. It gives us the context and the understanding. And yeah, so I think that taught me to advocate for the story, not for myself, like my precious writing. It's the voices of the interviewees, and they're sharing things. And if you're actually listening, they're sharing a great deal. And all those little asides or examples or stories serve a purpose. And so, yeah, I think that's just one aspect of it.
That's a really good point.
So in terms of sorry, can you repeat the question?
Sure, of course. What is your central concern with how health issues are being reported on currently?
So when it comes to this topic of medical assistance and dying, I only have a minute.
You can take a little longer, don't worry.
I don't think y'all want to be here for all that. Sure, one of my central concerns is actually that this is not being reported on. That it's not being reported on unless there is a court case or a court decision. That is how we got our current laws. It's a series of court decisions. You can go read up on the legal history. And then that when it is reported on, that the reporting still predominantly, in most cases, will focus on one side of the issue, which is we need this law. It's so important that we have this law, and now that we have it, everything is fine in Canada. There's nothing to be concerned about. Just continue on and let's expand it. Like, of course, MAiD for people whose only condition is a mental illness will be fine because everything's fine because I told you that everything is fine. So yeah, like that would be my main concern, that we're not actually having this conversation. To give you an example of that, this is funny. I'm a legally blind presenter is going to ask for a show of hands. So how many of you were aware that in March of this year, the United Nations Committee on the Rights of Persons with Disabilities said that the Canadian government needs to stop Track 2 MAiD and not do any further expansions, including expansion for MAiD for mental illness, mature minors, advanced requests? Did anyone know about this? But like what, 3 people? 4 or 5?
Yeah,
What happened in April of this year? What news event did we have? We had a federal election. How many times did you hear that come up on the election trail, on the campaign trail? Did you hear about it at debates? Did you hear statements from your parties? The Green Party was the only one that put out a statement, and it's kind of wonky if you actually go interview the Green Party, which I did, so I can tell you about that. So that would be, yeah, that's one of my main concerns. Like, we have a law that is getting massive international scrutiny, and my industry is not reporting on this country, and our politicians aren't talking about it, and almost 5% of all deaths in Canada now are legal lethal injections.
Yeah, I'll admit, I think as an outsider, I was quite naive into what I thought news making looked like. I thought it looked like it did in the movies. And when I got into newsrooms, was like really surprised by how much of the daily work of reporters is about sort of scanning the internet for ready-made texts, press releases, and sort of repurposing those as news texts. And I think that has a lot to do, or has everything to do, with the tremendous pressure that reporters are facing in the current economic challenges that journalism is confronting. You would both be able to speak to this in a lot more eloquent ways than I would, but continually having to do a lot more, cover more stories across more platforms more regularly, with less resources, space for in-depth reporting, support in the newsroom. And so it makes sense that they end up oftentimes sort of repurposing texts that allow them to meet this rapid pace of online news. But the concern and the way that that then comes to bear on a really complicated issue like HIV criminalization is it means that what ends up shaping the news discourse is press releases that police put out. And you essentially have a case where police are the ones who are dictating these public understandings of risk, public safety, public health, and forms of police reasoning or police definitions of these issues are flowing into mainstream news and then to the public. And so, yeah, I think the sort of economics, the way that reporters are set up in this particular context is really quite concerning.
No, I do have to agree with the point about the press releases, because it's something that we found in our work too, that it would be a lot of press releases from the Department of Justice that are just kind of getting repurposed, repackaged. I also want to say, to your point about the social determinants of health, I feel like when it comes to a singular text even, that is, 400 words, 500 words, it gets really hard to understand that when it comes to social determinants of health, it encompasses the community, it encompasses so much more beyond the individual. But the way the system works is that let's just focus on you. Let's focus on this one person, this individual, which is also tying back to what you were talking about with MAiD too. It's not, no one's thinking about it on the international level. No one's thinking about the impacts for the whole community. It's just this one person would really like to go forward in this. It's their decision. But thank you. Those are all great points. Okay, so the next question I have for you is, how can health journalism rebuild public trust in an era of misinformation, rapid digital consumption? So Colin touched on this point a little bit, as well as corporate media pressures, particularly by centering lived experience and ethical framing. Odette?
We're going with the flow here. Okay.
That's the order, I guess.
Okay. Okay. I think that, not just to hammer this nail too hard, but like without labeling all of the factors that come into play, I think we're actually working with the system in the fact that we're not talking about the power structures and the systems that lead to these situations, lead to these issues. And so we're doing the job of the system. And so I think that, you know, I think that can happen, without people fully realizing that that's what they're doing. That's what they're doing when they take those press releases at face value, when the RCMP issue release, and they might tweak it, they might, add a little more context to it, but they still haven't named the person that the cops killed. It's still a police interaction, or a fatal police interaction, using those. And similar in health issues, it might be more deferring to the institutional spokespeople. And for me, those aren't the people I want to hear, and I'd be much more interested in hearing the staff and frontline workers and their experiences, and then the families and the patients and the communities. Because, when we lose one person, we're not just losing that one person. It's not just the family has an empty chair at the table. Those people were meant to be our next teachers, language keepers, social workers, what have you. They were meant to have a role in that nation, in that community, in that village. And so it affects everybody. And I think that therefore we need everybody's voices to be considered, not just the person who's being handed the assignment that 5 people on their team drafted up a press release and gave it to them to put some sound bites or put some quotes to it. I think it is important to unravel the process a little bit. And where do the press releases come from? They come from the communications team. They don't necessarily come from, the head doctor working that ward or whatever. He may not even have contributed to that at all, but the quotes might be attributed to some of those leadership positions. So I think it's always important to talk to the community first and foremost and keep the story with them.
Right. Thank you.
Yeah, I mean, I won't try to be cool about this. I'm a big fan of both Meagan and Odette's work, and I follow their writing. And I think something that you both, just to make you uncomfortable with, something that you both do so well is sort of resist this common journalism trope for a really tight, clean, tidy story. I think both of your journalism embraces nuance and complexity and ambiguity, which I think leads to a more trusting readership. And of course, I think you both model what it looks like to center community, center people with lived experiences in your writing, which is hugely important. And I think when I was talking with reporters about what different types of reporting on HIV would look like, that's something that I heard again and again was like, they would often say, "But I need a face. Like I need someone with lived experience to speak to this issue, to speak to its effects and the ripple effects it has in community." I think to ask about what journalism can do to rebuild trust, that's a big ask just for one industry to take on. So I think it is also a collective effort of, for example, for community organizations, for activist groups who are impacted by these issues, to reach out to journalists, to develop relationships, to provide resources and supports for journalists who are doing this work, and to not just sort of thrust it all on journalists alone.
Colin, that's very kind of you. Thank you. Yeah, the question of trust in institutions, like that is a broader social question. You see that in like political party membership, you see that in things like union membership, you see that in religious institutions, you see that all over the place. So there are people who are much smarter than I am who can talk to you about what some of the threads have been that have led to our unraveling trust. It wasn't all the internet, but the internet and social media were a big part of it. There's more to it than that. But yeah, like just to reiterate Colin's point, like we are talking about a larger social question about the value of institutions, and if we view them as having value. In terms of what journalists can do, and we'll touch on this later, I know some of the questions about like advice for journalists and things like that. I do think trying, like you always want that human story, which is, it's funny as a journalist because that is why people like love us, and then that's why they hate us. Like they're just like, why do you always have to find this person who's going through a terrible day, and why are you? I'm like, I'm sorry, but like, I need that. So there is that, and then I've also had to learn as a reporter, sometimes you build trust by interviewing somebody or speaking to them actually, and we're gonna get to this more when we talk about practices, but you'll speak to a potential source And depending on the story, I'll tell them like, this is not being recorded. This is not on the record. I just want you to tell your story. And then you follow up with them a day or two later and you say like, how are you feeling? Do you want this to be on the record? And sometimes people say yes, which is very exciting because often as a reporter, people tell the story better the second time because they've had their warm-up round. And sometimes they say no. And it's learning to be like, you know what? Like, I just need to respect where that person is right now. And because I do feel like one of our jobs as reporters is to sit people like typically like ordinary, everyday Canadians who are just like going about, like, I'm saying Canadians because I work in Canada, like people who live in this country who are just, going about their life and saying like, you may not realize this, but there's something going on in your life that I think has importance for us as a whole nation. And you may not see it, but I see it. Like your story is incredibly important for this reason. And like sometimes people take you up on that and sometimes they don't. And there are days where you just have to be like, okay, like it is fine if you just want to go live your life and have a quiet life and not have me in my industry hounding you and your family for every difficult detail. You can go do that. So I think there's also that. There's a time to speak and there's a time to be silent. And there's a time to let people just have their lives and have their stories.
Right. Thank you. I do think it really does come down to respect too, and being aware of, where the other person is and like respecting their wishes too. I also want to say the point about what you were talking about with sometimes, the editors might say, or that kind of the corporation that, hey, it is easier to kind of repackage the press releases, but I think it is important to put time and resources. Sorry? Yeah. Right. To put time and resources towards being able to reach out to the community, and then also seeing that, if somebody does say that, hey, I don't want to go forward with this, then respecting that and not forcing that or anything like that. And yes, rebuilding public trust is something for politics and for media. It encompasses a lot. Okay, so the next question that I have for our lovely panel is, what systemic barriers prevent equitable reporting, and how can journalists and institutions address them? Also, how would you determine what constitutes equitable reporting? So I know we've gotten into this a little bit, so we can expand more.
Okay, I would like to jump in right at the equitable reporting part of that question. To me, we talk about parachute journalism, just coming in the crisis moments, taking the stories, and then we never see them again. I don't work that way. Like my Facebook is mostly people I've interviewed, and now they give me parenting advice, whatever. And so it is about relationship building, and I don't see that as veering away from journalistic ethics. I think we can, we're sophisticated. We can handle both truths, one in each hand. Like, yes, I'm a human. I'm connecting with this mother. She's fighting against police violence. I have a son. I worry about him. Whatever the case may be, I can be the human and emoting and sharing and learning with people I interview at the same time as doing the journalism ethics. And I don't do the draft sharing and, double checking everything, and doing the pre-interview. And, doing it that way doesn't have to feel robotic or dry or distanced. We can still be humans and interact and share the moment. I would like to share equitable reporting. To me is more about, sometimes it's story sharing, like during the pre-interview. Why does this story matter to me? My mom went to residential school. It doesn't take very much for me to build rapport with an elder if that's what we're focusing on. It gets weirder in the newsroom where that's seen very similarly as an education story. It's like, that's not a school. It's not an education story. This is a health story. But to me, it's more about solidarity, and story sharing is a good way to do that. But it's also about, what am I giving back to the community or the families who have shared their story with me? And so one example, it's a story in the Resolve. You can find it in the Resolve. It was mothers who have lost their children to police violence. And so police have killed their children, and they're healing. They're gathering together to fight for change, but also they're gathering just to try to heal. And so they were having a mother's healing walk on Vancouver Island around Tofino. And I could have done all those calls over the phone. You know, some of the moms were in Saskatchewan, some of them were here in Toronto. And I could have done those interviews and then headed to Montreal for an award. I was picking up an award, and it was just like, no, like, how could you do that? You know, I ended up getting one of my instructors at McGill to go and get the award for me. She had a nice dinner with her partner. But for me, like, the heart of the story was to go and be with these mothers, and like a huge gift, like feeling really grateful to even be invited to their healing walk. And so, and just also navigating that respectfully, like standing back when it's ceremony, and you know they're receiving some teachings from elders who came to help them process and move forward. But then walking, doing the full walk from Tofino up to farther up the island where we were, um, just walking with them until they felt like they wanted to start to talk. And that's very different than, hi, like I'll just have you for, if you have 10, 15 minutes, casual conversation on the phone. You know, it's very different vibe entirely. And so we're walking together, we're pausing, and we are weeping together as they tell me their story. Like, it's powerful. And some of the mothers were, Regis Korchinski-Paquette is from Toronto. His mom, Jermaine Carby, his mom was there. Chantel Moore's mother was there. Jared Lowndes' mother was there. And so I'm getting goosebumps because it's a huge gift for them to even want to share their story and to feel comfortable with you to tell your story and their story. And so just coming from a place of humility, but also gratitude to be allowed to hear this story. And you know, and people who the system has done so much harm to from day one. And that's the stories that they start to share. It's like, how has the system worked against us from birth on, right? And in some cases, I did get the birth story, you know, and I did hear about when their son was born. And so it's powerful storytelling, but only because there's a trust, and they know the story is going to be handled in a good way because they can tell by how I'm listening. And you can't do that if you're worried about, you know, let's keep this you know, journalistic ethics here. I'm not going to cry. You know, I do. I cry because I'm a human being. And that doesn't mean I'm centering my feelings. And, you know, I'm not, you know, putting myself in the story and knowing when to step back. And I think that's just a point of solidarity. And with the same group of mothers, they met outside the Parliament buildings in Victoria. And again, just holding two truths, one in each hand. I had my recorder, I did my photos, and then I put that down. Like, it was actually like a turn that button off, put my stuff in my bag, and I entered the street and took up a sign, and I walked with those mothers because I'm a mother who worries about all of our children and what the police could do to them any day, any city. And so yeah, I think that was really important. And I had it in my mind, like, I might have to explain myself, you know, to my editor. They might disapprove of this, but this is what I'm going to tell them, that we are humans first and foremost. And so the story has to be, these are humans first and foremost. And so are we, the readers. Like, just consider the systemic injustices that led to this situation, and consider that that can happen to any of us at any time. Some of us more so than others. And yeah, I feel like that's really important. Like, and that's not veering into communications work or advocacy. And so I think that we should be proud of ourselves when we can be entering and invited into the story. So the gift back is entering the story, making it personal too.
So what are some of the systemic barriers? I, for many years, have done a lot of reporting focused on disability policy, disability issues. That's how I ended up reporting on what we call medical assistance in dying. One of the systemic barriers when you are doing disability reporting is actually a disability. So, for example, I am fascinated by deaf culture. I think it's really interesting. I've been legally blind from birth. Like there's not like a blind culture thing. We don't have an equivalent. So I just think it's really, really interesting. But I am a hearing woman who can't, like, signed languages are not my first language, and I can't even really see them properly. Everything just looks like salad, the sign for salad. So when I've interviewed deaf individuals, like we've had to have very real conversations about how are we going to get this information like accurately, because we are facing a very real language barrier. People with different intellectual or developmental disabilities, people who may be non-speaking. And I know those aren't typically what people think about when they think about like the phrase systemic barriers, but there's actually a very real consideration when you want to tell the stories of people whose lives are most directly impacted by this, is how do we communicate in a way that I am understanding you accurately and conveying it accurately. I have a former editor in the audience today who can speak to this more on her side of this. Fact-checking. When you are fact-checking stories, when your sources have different disabilities, like that is an entirely different ballgame. So I would say, don't expect that all of your sources are quote unquote typically able-bodied people. Be prepared to provide accommodations within the interview process. But that's a really very real thing. There are lots of people whose stories I would love to be able to tell more. And because of this combination of their physical or intellectual disabilities and what social supports may or may not be available, those stories are really hard to get out there. So that's a really real thing. In terms of MAiD, I have not read the report that came out today. I can guess what some of the things in it are going to say. In terms of this issue in particular, the Canadian media, this is my industry, I understand, I'm part of this. I still think we honestly think that there's only one narrative when it comes to this story, and it's somebody would like MAiD, or somebody got it. Isn't that amazing? To which I sarcastically want to say in public, and this is my first time saying this in public on the record, I'm so excited. So the reality is that right now medical assistance in dying is legal in Canada, and it is, and people who are very big proponents of not just the current law, but of allowing it in other situations where we're not yet allowing that in Canada will say, this is a healthcare procedure. We want this to be treated as a healthcare procedure. Okay, so that's the argument. Another legal healthcare procedure in Canada is cataract surgery. Happens all the time. I've had 2 of them. Really glad for it. Nobody wrote an article when I had my cataracts removed. That would be ridiculous. Like, why? Why would you read that? So it fascinates me that there's still this, and some outlets do this more than others, like this over-reliance on this story of, look who got this, look at this couple who got this, many of those stories, and then also saying, but this is legal. And I'm like, well, like, then it's really not that interesting. Like, I don't understand, right? Like, it's just like this very kind of like double standard, or there's a lot of contradictions in there that I don't think people really realize. So that's one of the things. Another systemic barrier on the MAiD thing, this organization can get mentioned a lot, and it's kind of because they're the biggest game, and in some ways the only game in town on this, but Dying with Dignity Canada, which is the pro-MAiD charity / lobby group. If you go through, and these are public documents on a website, if you go through their financial statements and you see the list of donors, you will find the names of media companies. Now, I don't know what the nature of that donation is. I don't know if it was an employee, who died and like their colleagues made a donation on behalf of their colleague. Like that could have, like, I can't say why those companies' names are on there, but they're on there. And I can say I've pitched some stories that are critical of MAiD to publications that are owned by media companies who are listed as Dying with Dignity donors, and I was not accepted. So like that is a thing that happens, but I do think it's overall like a lack of imagination. when I read some of the reporting on MAiD in Canada, but also reporting elsewhere, let's say the New York Times recently, I honestly feel like I am back in 2012, 2013, where this wasn't legal at all. And it was the story of somebody who wanted something that they couldn't get in Canada. We are a decade removed from that. And you need to have your news judgment and your understanding of things be up to date. Like, we are in 2025. So that's something that I've found like the most fascinating about reporting on this, is how much people still want to revert back to a story template that we were using when this wasn't legal.
Yeah, I don't have too much to add. Thank you both for sharing these really powerful personal examples. It's just, yeah, not my place, I don't think, to speak about journalism practice, but what these stories make me think about is one of the things I was really surprised about when I was speaking with journalists is how fixated they were on this idea of objectivity. It was sort of all they wanted to speak about, which makes good sense. But Ed Young, who was doing a lot of the COVID-19 reporting, and I think was one of the wiser voices through the very peak of the pandemic, has said that objectivity is like the most oversold concept in journalism, and we would do a lot better to focus on other principles and values like equity. Odette, you name explicitly in your writing truth-telling, honesty, clarity. These are all other metrics we could be using to assess journalism and its value. And so, yeah, I think that's an important piece of advice to follow too.
Right. Thank you all for sharing. Like, that was very powerful. Okay, so the next questions that I have is, what concrete practices, from source selection to accountability mechanisms, can ensure reporting upholds health justice and avoids harm to marginalized communities? So I know, Odette, you already spoke on this a little bit, but yeah, feel free. Not putting you on the spot. Anyone else can speak to this too, about what practices can ensure that this reporting is reflective of health justice.
Okay, I can give them actually just maybe almost a flow chart through some of those harder, more difficult conversations. For instance, when I was going to interview Chantal Moore's mother, Martha Martin, that's one example that I remember. Pre-interview, we started chatting just through Messenger. We just started chatting a little bit, and just I knew that it might take time before we actually had our phone call. And then when we did have our phone call, whatever I had written notes to say just flew out the window instantly. And I let her know, when I first heard about your daughter, I was sitting in the same chair I'm in now. I was sitting at my kitchen table, and I opened my computer, and it was across the news. And I actually cried out in my household, like, and just, wordless, just a wordless grief kind of a sound. And me and all my friends were instantly talking about that and worrying about that. And as Indigenous moms, and we were with you then, and we're still with you now in your fight here. And there's a bit of a pause from her, and I just knew I guess that's self-locating, but it was really important to just be really transparent about, I have feelings about this. I have a reason why I care about this. And so now we can continue our conversation. But the tips that I would wish that journalists did maybe for every story would be, is it still a good time to chat? Just because we agreed to this yesterday, a week before, even 2 hours ago, like, is it still right now? And do you have someone with you? Feel free to grab someone. Like, do you want someone? And, I invite that when I'm asking for the interview. Please feel free to have someone sitting with you. That's fine. And then the other thing I would ask is, do you have someone to talk to after, when this is done? And because that's the worst thing for me to think of, especially if it's during COVID, a lot of phone interviews, that there's someone sitting at home at night. And if I'm thinking of their story when I'm lying in bed, they definitely are thinking of our conversation. And if they're alone at home and having to like process maybe something they've ongoing that they've had to be working on, but now there's this other thread, like now I put that out there and there's an interview with it recorded somewhere. And what is that person going to do with my story? So it's really important to me to do that pre-check. Like, do you have someone to talk to after this? And they'll say yes, or in that case, it was like, no, not right now, but it's fine. It's fine. I have a friend that I can call if I get upset. Okay. But then even through the interview, and so that led me to this practice of also a prearranged agreement. If you have to get off the phone or walk out the door during this interview at any time, there's no need to ask me or to have a big explainer to say, okay, I'm out, I gotta go. And this is too much. Or even, even if you just hang up, like I want to know ahead of time, so I'm not really, panicking, but, concerned over you. But let's just agree that there's no explainer required. Just hang up and we'll agree that we'll talk next week at some other time. And I think that's really important because you can almost, like even over a phone, you can hear someone ease into that. Like she cares, she's taking care of this. Okay. And maybe that's why I have some really good fortune in some of the storytelling that I've received and been gifted from people I interview, is because they feel like they have full control of that situation and they can end it anytime they want. And I'm encouraging them to do so. Please feel comfortable to do that. And then again, at the end, sometimes this is what I say, like sometimes I leave or I get off the phone and people, maybe it'll be like at midnight, you'll think, oh, damn, I shouldn't have said that. That's my sister's part of the story. That's not my story to tell. Or it's the opposite. I should have mentioned who gave me that teaching if I'm going to quote an elder's teaching. If anything comes to mind, let me know. Anything you want to add or subtract. And that's something that I was actually trained not to do. Don't give them wiggle room, like it's on the record, like you got it. And so, not to be, heartless about it, but I think the idea when I was being trained in that way was more, you have your story and then it's your work to continue with it. And I don't, even if I do have a hard deadline, I don't tell them that. I say, there's no rush on this. Even though they're like, well, maybe my boss might think there's a rush. But for me, there's no rush on this. I want you to feel like, you have the weekend, you have the week to think about it and things that come to mind. And so I found that by doing that, there were less retractions. There were far less second guesses or, oh, I should add this, and pad this or remove this, some of the harder truths that are shared. And so I think that that's really important. And then the same thing at the end. I'm just like, are you still okay? Like you have someone, do you have someone? And, with some of those mothers, I'm not getting off the phone until I hear that they have someone. Right. And I think that's really important. And, because without that, if you've entered into that relational and I care feeling, they will be phoning you on Facebook at midnight. And so I think that it's also just doing self-care all around to like build that into the interview process, build that into the pre-interviews process. And so then everybody's cared for from the beginning. And I think that that's really important. That would be a cool practice if that was just the norm.
So for sourcing, I'm just going to talk specifically about how I go about sourcing for an article related to MAiD. I think diversity is really important, and by that I mean diversity in viewpoint and opinion on this topic. So I used a phrase a few minutes ago, I talked about track to MAiD, which I assume everybody knows because doesn't everybody spend a good portion of their day thinking about this topic? Hopefully most of you don't spend a good portion of your day thinking about this. So track to MAiD, it became legal in 2021. It is for individuals with grievous and irremediable medical conditions whose a natural death is not reasonably foreseeable. So in practice, what that means is if you have a disability, if you have a chronic illness that you live with, like you are not in the process of dying, you are eligible. So I'm legally blind. I've been legally blind from birth, and I'm fairly confident that there are some doctors in this country who would approve me for MAiD. Why? Because we allow that. So I bring that up because A, to define my term, which I did not do earlier, but because in the discourse currently, there are many people who are like, that is bonkers. Like, you shouldn't, like, we should not be killing blind people because they are blind. Thank you. That is wrong. But they would still say that they personally agree with MAiD and what we call a track 1 situation, which is when somebody's death is reasonably foreseeable. Now, fun fact, which many of us in my industry, we did not always clarify, reasonably foreseeable is not terminal. It's broader than terminal. Canadian law does not actually require a prognosis of when doctors expect that you will die. Other jurisdictions with similar legislation do require a time prognosis. Canada has never allowed that. And the definition of reasonably foreseeable can vary from doctor to doctor, and some will put it at like years from now, even in a track 1 situation. So it's always been very nebulous. But all that to say, currently, you'll find a whole group of people who are like, I'm super concerned about track 2, but I still want track 1. I'm super concerned about MAiD for the sole condition of mental illness, but maybe not on these other things. So one of the things that I've tried really hard to do is to be able to get sources who enter in the, they come on the concern side at different parts in the journey. Just to show that there is a breadth of opinions on this, and you as a citizen or somebody or resident, as anybody who lives in this country and everyone who's just living, because if you live, you will die. That's kind of how it works. That you're aware of all the viewpoints, or as many viewpoints as possible out there. So when it comes to ideology, I try hard to do that. Concerns about Canada's MAiD laws. You will hear concerns from people from pretty much all political parties, various religious backgrounds, various non-religious backgrounds, like socioeconomic, race, disability, gender, sexual orientation, like all the things. It cuts across all the demographic markers. So trying to show that in reporting and showing the breadth of that, and also getting at some of the internal complexities that people feel. So I have had the opportunity, in some ways an honor, in the past few years to talk with health professionals who are involved in MAiD assessment and provision. Those are the words that we use in Canada to describe it. And for me, this is the only topic, I think, in my career where I will tell sources from the get-go. I give them a sense of where I stand on it. So I'll typically say, hi, my name's Meagan, reporting a piece about MAiD. And, I just want you to know, just so like, where I'm coming from, I am legally blind. I've been legally blind from birth, and I have concerns about our current law and expansion. That's all I say. Vast majority of cases, people, regardless of where they stand, are very grateful for that disclaimer. And I've sat, like as recently as a couple weeks ago, on a call with somebody who's been involved, a doctor who's been involved with this since it was legal, and listening to him talk through his concerns about what is currently allowed and what is potentially going to be allowed in March 2027, and listening to him talk that out. So like that's been really important to me. Also important, I think, just for the phrase of steel manning an argument, for having the statements that would cause the most concern to people who are opposed to this law, having those statements of concern actually come from people who are involved in it, so that it's coming, like, for lack of a better phrase, from the horse's mouth. And then in terms of sourcing, organizations are very helpful. Like, they can be on a variety of issues. So I wouldn't say discount them all together. Like, there is a movement in disability journalism to just be like, we don't want to hear from the big charities and we don't want to hear from the parents. And I think that's misguided. I think it has a good intent, but I think it kind of threw out the baby with the bathwater, for lack of a better word. So organizations are important, and like, make relationships. That's how I got a lot of stories. I knew that there was a charter challenge being filed against Track 2 MAiD a number of days before that charter challenge was filed, because I have years-long relationship with those organizations, and I would call them on a regular basis for 4 years. And every few months I would ask them, is the charter challenge happening yet? And that meant when it happened, I was the first person who got the call. So yeah, don't discount organizations, but I would say do not have them be the source of all your sources. So make relationships with normal people who are not affiliated with any like name or acronym. And a little tip for those of you who are interested in disability reporting and you want to interview disabled people, most of us are not actually affiliated with any large organization. We are just going about our lives, doing our everyday thing. You know, we are your friends, your neighbors, your colleagues. We're trying to infiltrate everybody. You know, and you're 27% of the population. You're just like everywhere. So yeah, like use organizations that can be very helpful for research, for statistics, for updates on legal cases, things like that. But broaden out beyond that and let that be a springboard and not your only board.
Great, thank you.
Just really quickly, I think to build on that from the perspective of those types of organizations who feel like reporting, hasn't been accountable or hasn't been equitable, I'll just plug some of the work of the HIV Legal Network and what those responses have looked like. If we have a sense that reporting is based on sometimes this text processing, copy and paste type of work, you can provide reporters with different types of text to copy and paste that sort of interrupt the flow or the easy flow of police documents. So publishing fact sheets, publishing information about those has been really helpful. And just to echo these parts about relationship building as well, that you don't necessarily have to wait for a journalist to contact you, that if there's a story or an angle that you think is missing, to reach out to reporters. If there's a story that is harmful or dangerous or reproducing these really problematic trends, I think we've also had some good fortune in reaching out to them and just sort of calling their attention to it. And that has led to changing newsroom practices. It's led to changing some reporting guides in some newsrooms. And so I think understanding it as a really sort of dialogical relationship is important.
All right, thank you. Those are all very insightful. I was scribble down some notes. I do want to say, Odette, when you were talking about, I think it is really important to build in care practices because at the end of the day, we are all human, and that kind of when that distancing happens and that sort of, robotic stuff keeps being reproduced, and that has negative effects as well. And I do want to say that about the perspectives, it's really important as well because sometimes there's this move to just pro, against, one sentence, couple paragraphs. There's like this kind of force balancing that occurs. So I do appreciate that in your work you do try, like you really do try to capture that spectrum because it's not just black and white as a lot of people might try to put it. All right, so the next question I have is, how do you sustain yourself in this work and form communities of support to move the benchmark in journalism? So I know that you already, thank you for sharing like very powerful stories that are emotional as well. Not to put you on the spot, but I feel like you would have a really good answer for this.
I don't know if it's a good answer, but it's my answer. I feel I've been given the teaching that story has agency, meaning each story has a spirit. And so it's not my story, it's not my voice, it's not my writing. And I feel like that builds in self-care for myself. Like maybe a story is heavy, or maybe it's ongoing, it's growing, it's getting more and more difficult. It sort of eases that in a way that I'm thinking, this isn't my creation. I'm a conduit here. I'm just channeling this spirit of story. And in that case, that's just how I'm able to do some heavy lifting. I think I've been a freelancer the past 4 years. All of my heavy stories were freelance stories. They weren't when I was in a more comfortable health beat reporter position. So that lacks any kind of, there's no debriefing circle. There's no, how's that story going? That's really tough. There's no check-ins. I'm just alone, working from home. And so I built up a community of the editors that take care of my stories, and therefore they're taking care of me. And so they're still my go-to people right now. Like Kayla Jefford Moore is a brilliant, brilliant editor, but she's also doing training now in the North, training Northern Institute training. I'm getting it wrong. Northern Journalism and JTI, maybe. Yeah, look it up. Northern Journalism Training Initiative, I think it is. Anyway, she's doing great work and, broadening that really special gift that she has to do that. But my point was, you find your people and your colleagues, and they might not even be reporting because there's a pretty heavy turnaround there too, because people can get burnt out. But they're still there for me if I'm in the middle of having a heavy story. And so without sharing the details of my story, I'm more like, yeah, I'm working on this theme. It's heavy, and just like having that like bit of release valve, I guess, on some of it. But again, just thinking it's the story is what's important. So therefore, the weight doesn't have to stay on me. It's just part of the work and just putting all my energy into the story. And it's also a good way to keep your voice and your bias and decentering yourself from the story too. You can have full 100% empathy for a story and without immersing myself and my thoughts into it. And I think that's just the best way to move through the story. Does that answer the question? Yeah.
Thank you. I think you got it. Really finicky.
So I've done MAiD reporting as a freelancer and as a staff reporter. So I actually started as a freelancer, did some of the heaviest ones as a freelancer. And it's the only time that an editor said, if you need to go to counseling, I will see if we can expense that. Which we ended up like not really pursuing in that time, but I've always remembered that. Like I've always remembered that. So if you are in this room, you're an editor, you're listening, like we as reporters, like we notice who says that and who takes care of us in that way. And like those are, I will go back and want to write for those people on hard topics again. Because I know that there can be a safe space. So one of the techniques, actually, I know this editor used, a couple editors used it, and now I try to do it with like reporting colleagues, is so it was the Walrus piece that came out in June 2023. But at the same time as I was working on that, I was working on a piece for Toronto Life about sexual abuse in a religious setting, and I was trying to finish a master's degree. I would recommend that you do not combine those three things. But anyways, I did. And it was like Neapolitan ice cream of terribleness. So I had some editors, actually both at the Walrus and Toronto Life, because they were aware of what was going on. And we would have conversations that went like, so what else have you done today, Meagan? And I was like, what? They're like, is anything else happening in your life? Like anything not related to these stories? And you actually have to sit there, because if you've been a part, it's like you're just in the trenches and all you can think about is everything is awful and everybody's awful and everything's awful. And to actually have to sit there and mentally be like, okay, well, I bought it, and this is a true story. I bought a new brand of soup at the grocery store made from upcycled vegetables, and I still actually want to write a story about upcycling vegetables to make soup, because food waste is bad. You should reduce it. So there is that, like there's that trick. And I know when I've done coaching with other journalists who are like on really heavy beats, like you do take a moment and you're like, okay, like let's talk about something else, like as a mental trick. And then outside of the world of journalism, because I'll talk about that more in the last question about why it's important to have a life outside of journalism. When I got my current job, one of the first things I did is I got a personal trainer. Because I sit a lot. And I knew that I would be reporting on this topic, and that can be incredibly emotionally draining, but not physically draining. So you do want to do something with your body so that you are sweating, like you actually have a physical release, and that your body can get tired to match up with your brain. Like you want there to be a synergy there. After my experience of let's just throw a bunch of sad stories together with a master's degree, a friend of mine was like, maybe you should go talk to a therapist about that. So yeah, like I go to therapy just to talk about work, and we cry. I try to set things up in a particular way. So one things I learned when I was freelancing about MAiD is if I had a MAiD interview, let's say at 10 in the morning, I could not work past a certain time. Like it would shorten my length of workable hours. So like there's like tricks about like you find music that you like to listen to. You make sure that you have food that you like to eat ready after. I am wearing this black tank top with white beading. It's actually braille beading. The designer behind this clothing line is a TMU graduate, Lecturer Jovanovic. And I reported on her clothing line when she had just graduated from this school and was trying to see if this thing could work. And I love the fact that I've been able to just watch this company from afar start from a project for like to graduate, to clothes that I could buy, to working with Stevie Wonder and having official Mattel Barbie things. Like I just think that's fun. And when I have a job where I started reporting about MAiD in 2020, spoiler alert, the number of MAiD deaths has only gone up. It's only going to continue to go up unless something changes. It's important for me to have a visible reminder of, you know what? And sometimes people make cool things and cool things grow, you know? And like between May and October, I get vegetables from a local garden. And every week I have to go pick them up and I get my email about what's new. And I am reminded that in a country where so many things go wrong and so many things are beyond our control, that strawberries still grow. And you can still bring them home and cook with them, and you can invite people over for dinner, and you can still enjoy good, beautiful things with people who matter to you, even when there are really hard things going on.
I thought I was gonna cry a lot earlier.
Yeah, I'll just add like the part about the question about moving the benchmark is sort of what jumps out to me. And I think it's just important to remember that from my view, like the benchmark of Canadian journalism is still quite high. Meagan and Odette's work is testament to that, that there are things that I think there's coverage of all sorts of stories that are frustrating and disappointing, but there are also regularly stories that are hugely impactful and make a real difference. So I think remembering that and keeping that center is helpful. And I think for movements, recognizing that journalism is a train of struggle, it's not the only train of struggle, it's one train of struggle as part of a long trajectory of an effort to move the big benchmark, and to understand it as a long journey.
Great, thank you, Meagan. That was very beautifully put. I want to go to a farmer's market now. And I do, Odette, when you were talking about decentering yourself, I think that's what I scribbled here. But no, I do have to agree that I'm with, you know, especially when it comes to reporting these sort of topics, like sometimes we're only looking at or we're only focused on who's the subject of the story or who's this going out to the audience, but also really considering that you as the writer are immersed in this and how that how you're taking care of yourself and seeing the supports that are being offered to you, right? Okay, so the last question we have here is, what advice would you give to future upcoming journalists? So I know that everyone has touched on this already, but if there's anything else, we'd love to hear what you have to say.
Yeah. Oh, I could bore you to tears about this, but yeah, it's just use your voice, use your voice, use your voice. Your voice really matters. It's the only thing we really have. We don't own anything really. That's the only thing we have is our voice. Use it because it helps others.
First of all, the industry is not dying, it's just changing. Like we've been saying, it's dying for decades, okay? So I get it, especially if you're in school, you're hearing that all the time. I heard that all the time too. So, you know, just take that with a grain of salt. And yeah, things are hard. I'm not gonna like lie and say that they aren't. The advice I always give is, first of all, this is a job about people. This is a people job. You are dealing with people with very real stories, and for whatever bizarre reason, you have the privilege of being invited into some of the most profound moments of people's lives. Whether that is moments of elation and just like really great things happening, or really hard things happening. So I think one of the roles of journalism is to tell people like you are seen and you are known and you are heard. But my other advice would be several. One is with all due respect to the conversations about objectivity and what role that can play in journalism and what that means. And I have a master's degree from Carleton University, and I swear that's like all we talked about in most of our classes. So I'm very well versed in that debate. I would say the key, if not one of the biggest key attributes that you will need as a journalist is humility. Know what you know and know what you don't know. Know that you need help. Know that, as Colin has been saying, the weight of the world does not rest on your shoulders. And we as an industry, I think, do a lot of damage to ourselves when we come in and say we are the ones who are going to fix everything. That doesn't mean that you can be irresponsible, but just please know that it does not all rest on you. And you will need something bigger and better and greater than yourself to do this. And yeah, like this job will expose you to a big, like the world is a big place, and you'll get to see and hear and experience a lot of it. So come with a lot of humility, come with a lot of curiosity. And then, so people with disabilities make up about 27% of the Canadian population. So I'm going to assume that I'm not the only one with one in this room. It's okay, you don't need to raise your hand. For those of you who are entering this field and you would fit into what we would typically call like an equity seeking or equity deserving group. I know in some newsrooms and in some organizations, there can be pressure to be like, oh, you're in this box, that must be all you will report on, and all of that. That is up to you. You get to decide what you want to do with that, okay? Like that's up to you. But I would say particularly for my disabled friends, please remember that it is part of your life. It is a part of your life that impacts all of your life, but it is not all of your life. So if you are making your entire self-concept based off of this one fact of you, I'm just gonna ask, like, is that enough? Is that enough of a foundation to build your entire life? And just be very aware of, for those of us who are doing work that is very close to who we are as people, there's a lot of like great opportunities and blessings and benefits that come with that, but there's also can be a really real burden that comes with that. So make sure that you're taking care of yourself and taking care of others, and make friends who aren't journalists. You know, I have a friend here who is not a journalist, and she's the one I saw Spotlight with first, which is still my favorite journalism movie. And then on a side note, because we are in Toronto, I'm cheering for a first place baseball team right now, and it does feel really good. Don't know how long this is lasting for, but I am here for it, for however long we can get it.
I would be really surprised if an aspiring journalist was seeking advice from a sociologist. But what I would say is that like we are facing like multiple overlapping crises in this moment. And to live our lives in this context, to make decisions in this context, we need like sound information to base our decisions on. And that's what journalism is all about. And so I think that is really, really worthwhile way to dedicate one's life. And I agree, Meagan, like since the printing press, there has been crises and concern about the downfall of the industry. And so I think there is still a space for this really important type of work and to go after that.
Great, thank you. I would like to open up to the floor for questions. Is there anybody? And online, if there's turn deep, you'll let me know. Yeah.
I mean, I just want to say thanks. Like I'm a former journalist. I used to be a journalist. I'm now an academic, sometimes an artist. But it was so great to hear journalists talking about the industry because I left in 2014. It just like
Panel, can we get a round of applause for our panelists? I'd like to thank you, Odette, Colin, and Meagan, for coming here today, for sharing your knowledge, for sharing your experience with us. I think we can all agree it was a very fruitful discussion. And even though I have chicken scratch on my papers, I will be writing something up from here. This is amazing. I would also like to thank our tech team and tech support and Turn Deep, Dave, and Anita for administrative support and planning for this event. I'd like to thank Danielle and Karen for making this event possible today. And thank you to everyone for attending and engaging with our talk here in person, as well as online on Zoom. Please make sure to check out our website for information on today's event, as well as future events, news, opportunities that we have coming up here at the CERC in health equity and community well-being. And I would also like to highlight our next event, which is happening on August 7th. And it's titled Fetishized Futures, Reclaiming Erotic Capital and Cultural Identity in the Colonial Gaze. This talk is with Dr. Corinne Sullivan, and this public lecture will examine the fetish, okay. It's on the board. Sorry, I practiced yesterday too. Okay, one more time. Examine the fetishization of Indigenous bodies and cultures through the lens of erotic capital, exploring how colonial legacies, racial stereotypes, and media commodify Indigenous sexuality. Drawing on the research with Indigenous sex workers, it highlights how Indigenous peoples navigate, resist, and reclaim these representations to assert agency and cultural identity. Please visit our website for more information, or the QR code on the screen. And for those of us in the room, we will be starting our live screening of the documentary Life After by Reed Davenport shortly. And please check out our work at the side over there. All right, thank you, everyone.